Pre-Eclampsic toxemia in pregnancy, causes, treatments and prevention. Hi, I'm Kathy Fray and I'm a semi-retired senior midwife, and welcome along to this explanation about PET or pre-eclampsic toxemia. And in about 10 minutes from now you should feel way more informed all about it. Okay, so it is only relatively recently, you've got notes I'm going to follow here of mine. It's only relatively recently in obstetric medicine, only really from about the late 60s, early 70s, that PET started to be regarded as not a threatened death sentence. Yeah, to both the mother and the baby. And these days it affects about, let's say 1 in 10, 1 in 40, somewhere about that, depending on where you are in the world of women. So basically it's a very common disease of pregnancy, and subsequently all midwives and obstetricians are generally very well trained not to miss its symptoms. The Latin term PET means pre-eclampsia, meaning pre-sudden violent seizure, and T means toxemia, or the old words of poisoned blood. And if you are diagnosed with PET under 36 to 37 weeks, the obstetrician will be doing a very fine potentially daily weighing up of your risk of that PET becoming E, meaning eclampsic seizures, versus the risk for your baby to be potentially born prematurely before its lungs are fully mature. Because the only cure for PET is giving birth. It's that placenta getting delivered. Supporting sleep and the circadian biorhythms is particularly important early in pregnancy, while that placenta is forming, that organ is being built around week 5 to week 12. So placental health is basically laid down in the first trimester. And yeah, that's why you feel so tired in the first trimester, because your body's working really hard. It's not just trying to establish the pregnancy, it's also growing a whole new organ. Pre-eclampsia is a placental disease and with systemic consequences, and it always requires medical diagnosis and obstetric management. Apart from obvious risk factors like having chronic essential hypertension or a prior history of preeclampsia, commonest risk factors include being a primip, that means a first time pregnancy, AMA or advanced maternal age, being over 35, obesity, say a BMI of 30 or more, having a long interval between pregnancies, say sort of a decade or more, family history of preeclampsic toxemia, say your mother or your sister, ethnicities, certain ethnicities, particularly blacks and American Indians, they're particularly higher risk. And also, actually, if you've got a change of partner and your body has not been exposed to their sperm very much, so say, for example, a woman who, say, was using contraception for years of the pill and having a regular exposure to her partner's sperm, versus a woman who, say, has been with a newer partner and they've used condoms the whole time apart from falling pregnant, then that has, the more exposure you've had to the sperm, the lower the risk of preeclampsic toxemia as well. We don't understand it all. The science is still not understood fully by obstetric medicine. However, the pathology is clear that sperm health impacts the chances of women having preeclampsia. Yeah, so that's why sometimes women can not have it at all, and then they've had a change of partner and have a baby with their partner, and suddenly they've got it for the first time. Okay, so preeclampsia is toxemia, PET, is where an integrative, holistic or whole body approach becomes not just sensible but actually responsible, rather than solely relying on allopathic pharmaceutical medicine to be the God's answer of everything, but also seeing your naturopathic medical herbalist, your classical homeopath, and your traditional Chinese acupuncturist. You want to throw everything at PET if you've got a diagnosis of it, to give your baby the best chance to be in the healthiest womb possible for the longest time possible. Outward symptoms of PET are high blood pressure, frontal headaches, visual disturbances, upper body edemic swelling, and proteinuria, protein in the urine. Now that how PET is diagnosed is an easy answer. It's hypertension or high blood pressure plus any of the following: renal dysfunction or liver dysfunction confirmed by blood tests, symptoms of HELP syndrome. HELP is H for hemolysis, which is the red blood cell breaking down faster than normal, EL, which is elevated liver enzymes, and LP, which is low platelets. Again, all of that is confirmed by blood tests. And then the other symptom can be uteroplacental dysfunction, meaning that there are abnormal Dopplers in the umbilical cord arteries. So in other words, now the blood getting to your baby is starting to get impacted as well, which is obviously not good for baby. Okay, so under the NICE guidelines, which are the globally regarded gold standard of obstetric best practice, low-dose aspirin is as a prophylactic given from 12 weeks onwards is recommended if a woman has any one of these risk factors: hypertensive disease previous to the pregnancy, meaning like chronic essential high blood pressure, chronic kidney disease, chronic renal disease, chronic autoimmune disease, or type 1, type 2 diabetes. If she's got one of those, prophylactic low-dose aspirin from 12 weeks onwards can seem to have a substantial improvement on her risk factors for developing pre-eclampsic toxemia. And then if a woman has any two of the following, then she should also be on them as well. If it's a first pregnancy, she's 40 years or over, then an interval of 10 years or more with the pregnancy, her body mass BMI, body mass index is 30 or more, she's got a family history of preeclampsia, e.g. a mother or sister who had it, and she has a multiple pregnancy of twins or triplets, etc. Now, I can see, this is going to end up being there's going to be a part 2 on this. Okay, so from a naturopathic and functional lens, PET or pre-eclampsic toxemia can be viewed at the point at which placental stress exceeds maternal adaptive capacity. When you are pregnant, your body is under more stress than it's ever been physiologically. You know, your cardiac output is 1.5 times a non-pregnant you. Your renal filtration is 1.5 times a non-pregnant you, etc. So if things are going to, cracks are going to show that your body can't cope with these levels of requirement, then that's when things like pre-eclampsic toxemia and gestational diabetes and other things start to rear their head. 4 maternal factors that are repeatedly emerged as contributors to that capacity, meaning things that can help or hinder preeclampsia. Actually, I think I'm going to stop it here, almost at 9 minutes. Let's kind of make this a part 2. Okay, see you in the next one.